Hello everyone, hello families, good morning, good evening, good night, depending on when or the time that you're watching this. My name is Dr. Alberto from Worsen's Clinic. Welcome one more time to one of our webinars. Today's lesson or today's slideshow is going to be about one of the most important, if not the most important aspects that has to be addressed and or worked out when we are talking about autism. And it is nutrition, diet, what it can yield or what it can transpire regarding improvements, as well as basically where to start. I'm mentioning this because for some families, especially new families or people who do not know way too much about this, diet is something that can be very, very confusing. There are 25, 30 different diets, different approaches, different roadmaps, different alternatives to follow, so much that can be overwhelming at the beginning. So my objective right now is to share with you, keyword share with you, some of the basic points as well as some of the fundamentals and the rationale behind each one of them, with the main concept of showing you which areas can improve just with diet, just with a correct nutrition, just with something as easy as changing different things or different foods at home. And this is not even mentioning about the stem cells. If you combine both, stem cells plus diet can yield fantastic results. However, let's focus today, strictly speaking, to diet nutrition. Now, as a tiny disclaimer, as always, I want to mention that the main reason of this presentation is to highlight the importance of dietary assessment, highlight the importance of an actual diet. In the previous webinar, we talked about the link between gastrointestinal malfunction and autism and the symptoms that can be triggered with a cheap or bad quality diet. Now that we have explained as much as possible about that link, that association, we're going to discuss about the importance of an actual diet and the potential improvements of them. Now, remember, same thing as I mentioned before, no good means no improvements. There are tons of families that are focusing their efforts on ancillary therapies like occupational therapy, ABA, speech therapy, medication. And although that is very useful, if you do not address the gastrointestinal part, if you do not address this immunological trigger aspect, then it's very possible that the improvements that you may be achieving are going to fade away because inflammation is appearing or it's coming back. Another thing, remember, this is informative only. Nothing is settled in stone. The fact that I'm sharing this with you does not mean that it's going to be specific for your kid. Remember, every kid has different needs, therefore the attention should be individualized. There is nothing that fits, there is no one size fits all, okay? And finally, although we are going to discuss about some particular aspects of supplements, this should not be taken as a prescription. You can follow them, you can easily find them. However, I'm not going to mention about dosages, I'm not going to mention about tests, because I do not want you to make mistakes that can yield to some form of regressions. So it's, again, is for let's say, educational purposes only. That way you can have a couple of tools for you to sit down with your doctor, with your biomedical doctor, with your pediatrician, with your MAPS doctor, and say, hey, can we evaluate this? Can we evaluate that? Because I'm noticing A, B, or Z with my kid. Now, having said that, what are the main objectives of tonight's presentation? Well, just a quick recap of how the stem cells work or the mechanism of action. Once again, because on the previous one, we discussed about how stem cells work with gastrointestinal and the linkage between gut-brain connection. Now, second aspect is mentioning again the gastrointestinal and autistic symptom expression, the linkage between each other, followed by the importance of the diet. That is just like a general background, general overview. Why is this? Because I want to focus on 5 common diets. Again, there are at least 20 to 25. These are the ones that I know that can be researched. There are different approaches. I'm just going to mention the 5 common diets that at least you have heard about. Then 6 common or 6 very famous supplements. And finally, 3 scenarios. I'm mentioning this as a scenario because, again, every kid is different, so it may or may not apply. It's just an example on how to approach from a dietary perspective, from a clinical in terms of you as parent, as family, as therapist, to identify some pointers on what you can think about in order for you to be able to discuss with your physicians. Now, quickly, just to remind, as a small reminder, how stem cell works, what's the mechanism of action? If I do stem cells, will that be the final answer to autism? Well, to be honest, and to be, as much as I love what we do, as much as I love working with stem cells, and as much as I love the result that we have achieved, stem cells is not going to be the final answer. Why is this? Because although stem cells can help you diminish the expression of certain symptoms because inflammation is being modulated and controlled, if you do not address the constant bumping of pro-inflammatory factors that are coming from your environment, from your diet, endogenous as well as exogenous, then if you're here and then you bring it down with cells, with the stem cells, the constant bumping of those pro-inflammatory factors are going to bring inflammation once again, and it's going to outshadow, it's going to outweigh whatever you have achieved. So once again, sorry for being repetitive, that is the nature, that is the reason why we want, or at least I want to be very emphatic or incisive about diet and gastrointestinal function. Now, quickly, how stem cell works, the stem cell effects. Remember the triad of autism: chronic inflammation, immune system dysfunction, and oxygen hypoperfusion or low oxygen flow, especially in the central nervous system. I am highlighting here in blue about the immune system regulations because that is where the highest link resides. The chronic inflammation, because there is some hyperimmune response, there is some hypersensitivity, there is some constant triggering of pro-inflammatory factors by the immune system as well as the gastrointestinal tract. That is where the stem cells are going to do the largest and the most important job, modulating the immune system to bring down as much as possible these pro-inflammatory factors, these markers, this hyper-reactivity of the immune system. Now, what are we looking to achieve? Remember the first webinar that we threw out to our social pages. The main objective, what we're trying to achieve with the stem cells as well with our patients who are diagnosed in the spectrum, it's the perfect homeostasis, or let's say a new normality, the best balance possible between central nervous system as well as the gastrointestinal tract. Why we focus so much on the gastrointestinal tract? Remember what we said a couple of slides ago: no gut, no improvements. The gastrointestinal tract is the #1 area, place, organ, system in which if something goes wrong, the immune system is going to complain. If the immune system complains, pro-inflammation or inflammation is going to appear. That's what we're looking to achieve. Perfect or the most balanced environment for both systems to work together. Now, what about the connection between the gut, the brain, and or gastrointestinal function, as well as ASD symptoms being expressed? Well, this one, it's fairly common, fairly known, very researched, diversely approached. However, keyword here, diversely approached, because there are tons of different ways to start working in the gastrointestinal function, because there are tons and tons and tons of different factors that have to be evaluated. Now, strictly speaking about the link between gastrointestinal function and symptoms. On the previous webinar we talked about absorption, inflammation in the gastrointestinal tract, leaky gut, etc., etc. So what we're going to mention right here as a quick reminder, let's remember poor intake. Doesn't matter how much your kid eats. If there is no absorption of nutrients, there is no absorption of minerals, there is no absorption of vitamins, your kid is going to suffer. The functionality is going to be impaired. Now, then we have the other aspect in which kids do not eat either very well, very balanced, or too much because whatever reasons, sensorial, touch, textures, smells, etc., etc. So remember, poor intake plus malabsorption is going to transpire into impaired functionality. Which functionality? Mostly cognitive, mostly developmental. Therefore, some of the milestones are going to be delayed. Now, that's on the development side. What happens physically? There's going to be wasting. Remember on the previous one, height may not be affected, but weight will be affected. Or in some other cases, wasting syndrome, in which they have some form, they have achieved, the kids have actually achieved a particular weight, and then they start losing muscle mass, not fat, but muscle mass. On the other hand, we have behavior, we have aggression, we have, remember on the previous one, a bad gut can transpire into posture or posturing, which is a position that the kids adopt when they are struggling with constipation, with diarrhea, with pain, with cramps. It's going to transpire into irritability. Irritability is the first indicator of potential aggressive behaviors. So let's keep in mind that, sorry, I'm not trying to scare anyone. I'm just highlighting the importance of gastrointestinal function, okay? Now, there is something that it's a little bit of a misconception. It's partially true. There are lots of families that say, my kid is allergic to, and then they come up with a list of 20, 30, 40 different ingredients or foods or edibles. Now, it's not exactly that the kid is allergic to it. What happens is that your boy or your girl, it's actually very, very sensitive to it. Therefore, if they eat something that has refined flour or refined carbohydrates or refined sugar, it's going to promote temporal or localized inflammation that is going to affect initially on behavior. So let's focus on that as well. Evaluate what your boy is eating or your girl is eating. And on the other hand, we also have associated with the behavior tantrums without an actual explanation. So I highlighting here as, well, not highlight, is underline. There is this tiny approach in which some families, they do a lot of research over the internet or based on suggestions from other families of something that it worked for one patient, but is not going to work on another patient. And that is the use of multivitamins or multiminerals compounds. And consuming way too much of this can also have adverse effects. That doesn't, the fact that they are eating them too much in a neurotypical person, whatever is going to happen, what actually is going to happen is that you are just paying for a very expensive urine, because whatever is not needed is going to be excreted. Just remember that in a kid with autism, way too much vitamins, way too much minerals, way too much supplementation, especially the ones that are multivitamins in one presentation, the excessive amount of them, it's something that cannot be absorbed and metabolized and eliminated that easily. So if possible, yeah, sure, multi-supplementation is recommended, but not in one pill. So what about assessment? How do we know that kids are struggling with something associated by the gastrointestinal tract at home? Anthropometrics pretty much means age, weight, size of your boy or your girl. How can you compare them? You can find online pediatric charts that are going to say if your boy is 5 years of age, he should weight and his measure should be X, Y, Z. So if your boy is above or under them, that's fine, and there's going to be some markers or red flags when your boy is very, very under those markers or those percentiles or very much above of them. Remember, the fact that a patient, the pediatric patient, weighs a lot doesn't mean that he or she is healthy, okay? So Another part is dietary evaluation. By dietary evaluation doesn't mean that you have to go to a nutritionist initially or to a doctor. Just take in consideration what type of food your kid is consuming. There are some kids, we have had some patients that are hooked on nuggets or the nuggets from the food chains. Yeah, maybe those are tasty eventually every now and then, sure, as an adult, I like them every 3 months or so, but on a daily basis is not adequate because everything is processed, highly processed, everything is refined. I know that it's a difficult habit to break. However, this is the type of dietary evaluation that you should take or you should pay attention. What is being consumed by my kid? Now, clinical indicators is the thing that we just discussed a few seconds ago. The behaviors, the loss of muscle mass, difficulties gaining weight. So let's pay attention to that. And finally, laboratories. There are some laboratories that you can put your finger on. This one must be prescribed by any physician, by any doctor of your choice, because it's not going to be that easy for you just to appear into a laboratory to request one particular test. I know that there is a way to turn around to it, and maybe you can, however, it may not be available everywhere. Now, what about where to start or how to initiate this? If we forget about what we just said in the previous slide for a second, I'm new at this. I don't know where to start. What should I do? What should I pay the most attention to at home? Very simple. Let's try to aim as much as possible to an organic, clean type of diet. This doesn't mean that you have to have your own cow, that you have to have your own farm, that you have to have your own harvesting process methods of food. I know that that's very utopic. However, what I mean about ideal in terms of quality is try to get the cleanest food possible. Why is this? Mostly because there is some toxins associated with the type of food that is given to the beef. The type of I don't know, chemicals that are used to preserve vegetables. The type of soil, where they are harvested, how they are transported, where they are kept, how they are sold, how they are preserved for mass production or mass selling. So that's why organic is on a trend, because there is this focus on eating as clean as possible, trying to eliminate as much as possible environmental toxins. Another thing, oh, just a quick fact. This ideal diet or this ideal clean food, it can be useful just by eliminating all these crappy toxins that I was talking about. Now, when it comes about fats and oils, there are lots of things that you may hear about. One of them consisting on butter, what type of butter, ghee, oils, different type of oils, olive oil, extra virgin oil, avocado oil, coconut oil, etc., etc. There are different type of oils. The idea is to focus initially on good fats, okay? Fats that are rich in omega-3, for example. Now, natural sweeteners. Technically, a patient who is diagnosed within the spectrum should be as much under control as possible when it comes to the consumption of simple carbohydrates. If there is a need, because it's the only way that you as a parent can trick your boy or your girl to consume some, I don't know, smoothie, food or his portion of food at the time, and it has to be slightly sweet, you can use stevia, okay? It's actually allowed. However, every natural sweetener should be under control, not abuse of it. But you should stay away from everything that is refined, like refined sugar or white sugar, powdered sugar. Now, why or what is the importance in this? First of all, because you are actually manipulating or taking under control what I was saying a few moments ago, the environmental factors, the environmental toxins, the potential heavy metals that may be, let's say, in salmon, because they are salmon farms. You can actually start gradually tweaking your kid's diet into being more balanced. We're going to talk about a little bit of diet in a few moments. The idea is, remember that actually a fatty diet is not going to be a problem, but a balance, a proper, healthy, clean, nice diet, that is the problem, okay? And also, the diet eventually, with the more you know about this, the more you are soaked, or the more you are researching about diets and the gastrointestinal tract, you are going to orientate your diet towards whatever are the therapeutic needs of your boy. For example, the so famous and quite complicated to control the yeast, how to use probiotics if your boy requires enzymes, because there is difficulty for some patients to process and metabolize and break down or absorb different type of proteins. You can understand, and maybe you can identify that if you eliminate or substitute one type of food, one type of ingredient, or even the brand of one type of food, you can notice that some sensitivities, hypersensitivities, or even sensorial expression or reaction from your kid can reduce. So just take a second and read this last part. Just with tiny changes that you can do at home, let's say for free, somehow easily, just under trial and error, can yield to a potential benefit for your kid, okay? And finally, once again, let's remember about the gut-brain connection. Why is this? The gastrointestinal tract, or let's say the gut, it's covered under the arm of the vagus nerve. The vagus nerve is associated with bowel function, and it has some anti-inflammatory action. Physiologically speaking, very few people knows about this, especially because the proper function of the vagus nerve is going to transpire into the best gastrointestinal activity or motility. Now, cortisol is a hormone that it's usually elevated in kids with autism. So the higher the cortisol, there are possibilities for that patient to struggle with muscle affection, also associated with restless leg syndrome. Basically, when the kid is sleeping, even if it's for 30 minutes, an hour, 2 hours, 3 hours, you're going to notice that your kid is throwing kicks or kicking, okay, or expressing some form of extreme semi-violent movements, or occasional semi-violent movements. Also, high elevation of cortisol can transpire into a deficient immune response, okay? As well as dysbiosis. Let's remember that dysbiosis is when the balance of the so-called homeostasis of the gastrointestinal tract may be compromised because the good bacteria that should be there is not in order, okay? Now, on a side note, or as a side note, dysbiosis is very much associated with behavioral changes. Once again, you may notice that when your boy has, or your girl has eats a slice of white bread or piece of candy or something like that, just because of the dysbiosis, for you or me, we can feel a little bit of inflammation, maybe some gas, maybe some pain, and that's it. But for kids within the spectrum, that discomfort that we may feel or experience, for them, it's 3 or 4 or 5 times stronger. So that is going to change behavior. And the only way that some of the patients know how to react is yelling, tantrums, screaming, the posturing. So, and the behavior tend to change so much that families think that they are regressing. And it's not like they are regressing. It's whatever achievement you have observed is currently being covered or eclipsed by this negative behavior. Now, on the other hand, when talking about dysbiosis, remember that there should be traditional flora present in there, or good bacteria. If this bacteria is not balanced, if this bacteria is not present, if this bacteria is not adequate, and it's just allowing yeast and fungi and other microorganisms that should be there, but they are hyper-proliferating, then this can cause some constant immune alterations that eventually may trigger some form of autoimmunity. The most common one is associated with frequent streptococcus infections or throat infection, strep throat. And when there is a history of frequent strep throat, traditionally that patient should be tested for pandas, okay? That's something that has to be done with your physician. Just keep it in mind, write it down, consider it as let's say a fun fact. If you notice that your kid behavior or is changing dramatically for a day, 2 days, 3 days, and then at the end of that time lapse, everything goes down and your boy is the same as he was prior to this event or flare-up, potentially there is a possibility that there is some autoimmunity activity going on. Usually it's pandas, okay? So it's just in order for you to keep in mind as a fun fact, okay? Now, pay attention for a moment to this diagram. It's just like the circle of behavior of diet and the symptoms of autism, okay? Now, usually everybody, when we are right there where the black label is that says autism, everybody is trying to bomb or to act as quick as possible in order to try to control this symptomatic expression of the disorder. Now, what everybody is trying to do is immediately do dietary changes and bombing with supplements and doing different things in order to break the circle right here, okay? That's great because that's actually doing something. That is, to be honest, and with all the respect for everyone, that is more than a lot of people is currently doing, with or without being in the spectrum, okay? However, our suggestion based on what we notice or the experience that we have gathered with our patients, the best area, the best thing to do, especially at home, is breaking the circle right here. How is this? With what I just told you. So in diet, probiotics, maybe with some supplements that I'm going to mention in a few moments, changing or evaluating the diet, paying attention to some of the symptoms. The reason why we suggest working in this part is because you can do it one at a time. That way you can actually log down, maybe you can have a diary in which you are logging what is working, what is not working, what is enhancing or what is worsening the situation. Whereas if you're working only here in this part, you are only trying to suppress the last symptom being expressed, okay? And that can be very, very complicated because usually the therapeutic approach is doing a lot of things at the same time. And when it's time to move, to change or to evaluate those different approaches, you do not know which one is working, okay? So that is a suggestion. Try to break it on the first, on the arrow that is on the lower side, lower left side. Now, I want to mention about 5 diets. Again, there are tons of them that at least you have heard one time before. And this is specifically giving some pointers in order for you to identify, A, my kid is expressing 2 or 3 of the symptoms that you're mentioning. I'm going to try this one. I'm going to try the other one because now you have a little bit of the fundamentals or the rationale behind it. So, diet number 1, the very famous gluten-free, casein-free, soy-free diet. Now, what it consists, what is it about? Pretty much as the name says, reducing or eliminating as much as possible the gluten, eliminating casein or milky products, and not consuming soy whole foods, okay? I have to make a tiny side note in here that it's not necessary to eliminate egg, okay? Egg doesn't have any of this. Some families or some doctors suggest eliminating the egg as well as corn because the kid may be sensitive to it. However, let's not focus on way too much ingredients at a time. Let's try one at a time. Gluten and casein, and if it's working, you can try with soy, but initially you can start with gluten and casein. Why is this? Basically because the size of the molecules of the gluten or the proteins of the gluten and the casein, it's very big for the immune system, the gastrointestinal system, to break it down and absorb it. This is the thing that tends to cause some form of intolerance, okay? It's not exactly that a patient is allergic to it. However, there is a possibility, because it happens, that there is one person out of every 15 or 20 that may be actually allergic to bread, or to gluten in this case, or to casein, or in some cases to the actual milk, okay? So if this is the situation, that's one of the reasons why you can cross it over from your list. Another one, these are considered as opioid type of foods. By opioid, this means that it can cause some form of lethargic activity, okay, in which you notice that after consuming one of these ingredients, your kid is acting or responding a little bit slower than usual, maybe feeling a little bit exhausted, on the low side. For some, that might be beneficial, but intellectually speaking, is not, because it's actually blocking or hindering a cognitive response. And finally, because the molecule size is going to be, it can be pro-inflammatory. It can trigger an inflammatory response in the gastrointestinal tract, because the immune system is hyper-responding to these proteins. Now, who may benefit of this diet? Kids who are craving these type of ingredients, kids that you notice that they have poor eye contact, or the eye contact is going down every time that they consume this, or the social skills are going downhill, where there is not too much tolerance to it. Maybe they drink it, but they throw it up. Maybe they consume whatever of these ingredients, but you notice some stool changes, diarrhea, or constipation, mostly constipation. And when you notice OCD behaviors or aggressive behaviors, or also known as self-inflicted injuries, when kids are biting too much themselves, when kids are healing themselves, there is a possibility that one very large molecule that they are eating, it's the trigger, or one of the potential causes of this. What is the tricky part with any diet is identifying which one, okay? Now, that's why you have to go step by step. I know that it's a slow process, but if you take your time, it's going to yield better results than just changing the diet dramatically. Changing the diet from one day to another, it's possible, but it's a nightmare, especially for kids, all right? Now, diet number 2. I'm putting here together two types of diets, somewhat similar. One is the modified Atkins diet, and the other is the very famous and very trendy keto diet. The main objective of both, or both that I'm mentioning here, is creating, pushing, triggering ketosis, okay? What the diet consists of, it's pretty much consuming a low amount of carbs. Modified Atkins diet is somehow around 15% of carbohydrates, or a low amount of carbohydrates, and an actual keto diet is under 5% of carbohydrate consumption. 5% is under 20 grams per day of carbohydrates. So you are consuming a high amount of fats, remember, good fats, and the amount of protein should be about half of it, you don't have to over abuse on protein consumption, especially in kids. If you are doing keto diet as an adult because your goals are different, you can tweak it. However, for kids, we are talking about high fat consumption, mid amount of protein, and very low to almost no carbohydrate consumption. Why is this recommended, or what is the actual rationale behind this? Mostly for seizure control in those patients within the spectrum who struggle with epilepsy, right? As I said before, this type of diet induces ketosis. And it's proven that in about 58% of kids within the spectrum, the frequency and or intensity of the seizures can reduce up to 50% just with this diet, okay? Now, why is this exactly? Good fat is neuroprotective. This is something that we always tell our patients. The brain needs glucose, oxygen, and cholesterol, okay? Good cholesterol. Cholesterol should be between 160 to 190. So if your kid has 90, 100, 110, we need to increase the fat consumption, okay? Who may benefit from this diet? As I said before, patients who are diagnosed with epilepsy or who are experiencing seizures as part of the spectrum, because it's part of the spectrum in some cases, as well as patients who are having mitochondrial dysfunctions. Remember, the mitochondria is a power plant of the cells, any cell. So if the mitochondria is not working properly, that cell is going to perform poorly. Another diet, a specific or handpicked or selected carbohydrate diet. The reason of this one is, or what it consists of, it's actually consuming simple, one chain or monosaccharide carbohydrates like non-starch. If you're going to consume sweet, it's going to be honey, basic fruits, no complex carbs. Traditionally, it's based on vegetables, on healthy fats, and some amount of proteins. Why is this? What's the rationale behind this? To control yeast. Yeast is one of the nightmares that every single doctor as well as family may be dealing at one point in this journey. Yeast is difficult. Once you manage to control yeast, you're almost there. You're almost on the other side, okay? Now, why it's important to select or to handpick the carbohydrates. Specifically, remember that yeast is complicated, okay? Yeast should be part of our natural flora. However, when there is a hyperproliferation of yeast, yeast is going to feed on carbohydrates. Yeast is fed on complex sugars that tends to ferment in your gastrointestinal tract. So that's mainly the reason. It's as you can notice down there. Who may benefit about this is patients who are struggling with hidden yeast or complicated yeast eradication. Okay. However, this has some benefits. Two, you can gradually introduce new foods one by one, as well as it helps you to identify some form of food sensitivity, as well as it can help to eliminate some such sensitivity. For example, remember, it doesn't mean that your kid is allergic. It may be sensitive to it, meaning that if this hyperinflammation or hyperresponse to some food starts to go down, it's very likely that your boy is going to be able to eat a new type of food, a new type of vegetable, a new type of protein, okay? Who may benefit of this type of diet? Kids who are struggling with poor stools, example, diarrhea, as a synergic antifungal treatment. By synergic, I'm mentioning once again, it consists of treating yeast because it's quite complicated to control. Now, patients who are craving on different type of carbohydrates, so it can be easier to switch from every single carbohydrate available to gradually switch to a hand-picked carbohydrate that you know is going to be beneficial for your boy. And for example, you can identify that maybe if your kid has eczema or some form of skin rash, you can try this diet in order to eliminate that hyper response of the skin, because it can be a sensitive reaction, okay, or a potential allergic reaction. Another diet, low oxalate diet. Well, this is quite tricky because this is from this particular diet, new alternatives or some diets arise, like raw diet, like smoothies, or green diet, or there's another one known as simply green or only green diet, etc., etc. So I'm not saying that those are of no use. Actually, they do work. However, it's important for you to understand that if you notice that your kid is wetting the bed, that if your kid is expressing some form of regression even after having the healthiest of the smoothies, if you notice that there is some form of pain or discomfort after eating under one particular type of diet, it's not exactly the smoothie or the ingredients or anything like that. Perhaps it's that your boy or your girl is forming oxalates, and oxalates tend to hurt. Oxalates become crystals. Oxalates are actually absorbed, especially in those patients who struggle with leaky gut. Okay, so the reason why of going down on this type of foods is exactly that, avoiding as much as possible the formation of these oxalate crystals. Now, fungi, it's also a trigger or a potential cause of oxalate formation. Now, and they are pretty much synergic. So high presence of oxalates is going to allow the presence of fungus and the other way around. And this is going to cause inflammation and gastrointestinal discomfort. Now, as another pearl or fun fact, there was this study in kids in which about 59% of the patients, they had a tube of plasma tested, and they showed 3 times higher levels of oxalates in patients within the spectrum if we compare them with neurotypical kids. So it's important. What is needed to be avoided? Gradually, you can study about nuts, about beans, about some different greens like spinach or chard or beets in some cases. So it's just a matter for you to gradually identify one by one. Do not eliminate everything. It has to be gradual. That way you are identifying, because it's not a happy thing that some of the patients have a limited diet in terms of diversity, and then because of medical orders or doctor's orders, or because the family wants to try something new, just to wipe down all simple type of foods. That's not, doesn't, it's possible, but it's not nice, and that can create some form of aversion from the patient. Okay, now finally, the one that I don't like, because it can be a little bit confusing, however, it is somehow famous, and it's the low phenol diet or low salicylate diet, also known as the Failsafe diet. Now, what is it? Pretty much avoiding every single type of food that has some form of additives and preservatives. The reason why I'm not exactly a huge fan of this is because pretty much everything has additives and preservatives, okay? So once again, we go back to the very organic, clean, almost self-harvested foods, okay? Now, when we say that no salicylate consuming, we mean about pretty much berries, and in some cases almonds, some tomatoes. So why is this? What's the mechanism of action, or what is the research or the rationale behind this? Because pretty much kids may have a difficulty to metabolize, break it, and absorb it. Also, if there is a microbiome or dysbiosis present in the gastrointestinal tract, it's very difficult to process and break down the phenols, okay? And this is going to cause different behavioral changes, as we mentioned it a few moments ago, and I wrote them down again: hyperactivity, behavioral or mood swings, cravings, aggression, possible regression, or laughter. So the idea here is to gradually reduce or eliminate this, because it helps to do 2 things. You are eliminating some foods that you are identifying that are not responding adequately with your kid, and at the same time you are identifying that there is a dysbiosis problem. And as I said, if you are identifying abnormal laughter, some form of aggressive behavior, mood changes, red cheeks, that indicate a phenol difficulty, okay? Now, moving forward, or changing a little bit the topic, it's mentioning supplements. To be honest, lots of families ask us here when you come for treatment, hey, what can I give my kid? What can I use? What do you suggest, etc., etc. To be honest, we as physicians right here in our clinic, we are not married with one particular type of supplement. We are not married with one particular type of brand. It's true, the difference in brands, the difference in price, the difference in the dosages can make a difference, sure, because it's different qualities, different laboratories, different methods of packaging. The dosages, maybe the vehicle of the supplement can be different, but at the same time, some of the supplements can be consumed through food. Okay, again, there is a huge difference between supplement than a substitute. All right, so let's evaluate those ones. For example, we have vitamin D. Vitamin D is very essential for bone structure. Vitamin D is something that you can manufacture by exposing yourself to the sun. Okay, It's been it helps to fixate calcium to the bones. It helps with mood. It helps with your cells because it helps to the mitochondria as well. Now, what may be the signs of those kids that may be needing vitamin D? Low muscle tone, obviously, eczema, some skin problems, rashes, or the delay in tooth in teeth growth. Okay, if you notice changes in the color, in the shape, the form, or the size of the teeth of your kid, that's the reason why we encourage you to visit your doctor, because also by age, following the percentiles that I was mentioning, the teeth should be starting to appear or can be slightly delayed. However, if your boy is 9 or 10 years of age and the kid hasn't been on the changing process, well, we have a problem there, okay? Another one, vitamin A. What is essential for what it's used for? Pretty much immune system. It's very linked, it's very much associated with your immune system. The very famous eyesight, everything that is associated with retinoids, it helps to the eye and cellular communication. Now, what symptoms your kid may express if they are deficient in vitamin A? Obviously, dry eyes, flaky skin, and I'm mentioning here viruses, especially because vitamin A is known to be a very good antiviral in a natural way, okay? However, overdosing vitamin A, it's negative, right? Doesn't mean that the fact that you identify my kid has dry eyes, I'm noticing something funny in the skin, he scratches way too much, or something like that, doesn't mean that you have to pack your kid with a lot of vitamin A, right? So that's the reason why I'm not mentioning about dosages. I'm suggesting what to pay attention, what to look for, and then you can compile this information and show it to your doctor. Hey, can we consider this? Can we consider that? Now, one of my favorites, zinc. Why is one of my favorites? Because it's one of the easiest to consume, the easiest to administer, as well as the easiest to achieve throughout food, okay? Now, what is it for? What is the main reason? It helps with your immune system. It helps to synthesize proteins. It helps with growth and development, as well as it helps with your senses. Now, usually if you notice that your kid is struggling with constant eczema, it can point towards a zinc deficiency. This, we mentioned it in the previous webinar as well. And I'm not just like repeating everything in every single presentation. I'm mentioning because I cannot emphasize enough the importance of all this to help patients with autism. Now, a very important fact is that, remember a few moments ago that I said, we do not recommend multivitamins, the ones that it comes everything in one pill. And that is exactly one of the reasons why we don't recommend that is because zinc must be administered individually. One, to achieve the optimal levels. Two, because in combination or if it's present with other type of vitamins or supplements, the absorption can be compromised. And that's something that actually we have to avoid. We have to aim for better absorption. Now, what may be other symptoms that or signals that you have to catch in your kid, maybe to consider a zinc deficiency? If they are picky eaters, sensorial patients, by sensorial I mean patients that are very, it's associated with picky eater, and by sensorial I mean kids who like to eat crunchy stuff but not soft stuff or soft food, or the other way around. For example, I always make this exercise with some patients. Maybe your kid likes raw carrot, but he or she does not like cooked carrot. It's the same thing, it's still a carrot, however the texture is different. That is what we mean with sensorial, okay? Where when patients have brittle fingernails, when they look, they have some white vertical lines. Again, as I said before, skin problems and or frequent infections. Frequent infections, ear infections or throat infections or UTI infections can be an indication of zinc deficiency, all right? Now, my second favorite, magnesium. Why is my second favorite? Because it's pretty much highly associated with behavioral changes, positive behavioral changes. Why is this? Because it helps a lot with the gastrointestinal tract. one of the essentials, as it's mentioned here, it helps with protein synthesis, just like zinc. It helps with magnesium and nerves. What I mean with nerves is for those patients who struggle with cramps, restless leg syndrome, as I said before, is associated with sensorial processing, as I said a few seconds ago, with zinc. And there is a variety of magnesium presentations that can actually go through the blood-brain barrier, okay? Now, about the signs or what you can pay attention, sorry for the typo right there, about the signs or some of the cues that you can identify when a kid is deficient in magnesium, it's pretty much associated with behavior. That's why it's almost universal that a kid within the spectrum is going to be prescribed magnesium. Why? Once again, gastrointestinal function, it helps a lot with constipation, helps bringing down anxiety. As I said a few seconds ago, helps with sensory processing like light, sounds, and smells, and therefore helps also with hyperactivity. Hyperactivity is not is a symptom caused by systemic or psychological overload, okay? It's the way that they have, is the equivalent of steaming, is the way a kid has to self-control or try to cool down their senses. And almost finally, the number 5, B12 and folate or folate supplements. I put them in the same slide, but it's two different things. B12, there is this conception that B12 is very useful in any way, shape, or form. Traditionally, the recommended is methyl B12, is a precursor of the B12. What is it needed for? Helps with a healthy immunological system because it helps with the production of red blood cells. Helps a lot with neurological function and everything that is associated with nerve connection, nerve connectivity, with tics. It helps to calm down or to reduce neurological hyperreactivity. It's a cofactor with methylation. This is highly associated, or it's pretty much needed with glutathione and methylation. Now, what are some of the causes of B12 deficiency? Aside of malabsorption, the very famous MTHFR mutation or change, which is the methylation deficiency or this genetic mutation that does not allow you to absorb or create B12 as well as folate deficiency. Now, on the other hand, we have folate, which it's associated with methylation with a healthy DNA synthesis, also with the blood. And some of the symptoms that kids who are deficient in either one of these is usually associated with depression, fatigue, behavior changes, or hyperreactive behavior changes, and in some cases, headache. Mostly, I want to point out that these symptoms are associated with some form of delay or opioid activity. It's like being lethargic, like, I forgot the word, brain fog. It's associated with a brain fog reaction, okay? Now, regarding folate, do not consume, do not share, do not give your kid folic acid. What it's recommended is folinic acid. That is the precursor because that is the thing that you need to fulfill or to complement the methylation circle, okay, or the cycle, sorry. And therefore you have to promote methylation with the help of glutathione as well as the B12 and the folates. Now, finally, the very famous probiotics. Which one? Whatever you want, honestly. As long as it's high quality, as long as it's coming from a reputable shop or a reputable laboratory, as long as maybe the one that you've seen the best recommendations or the best reviews. Because you can find probiotics that are extremely cheap from $2.50 or maybe $3 all the way to $45 a bottle, okay? So I'm not saying that the most expensive is the best. I'm just saying that you have to do a little bit of research which one is the best because it's very important to understand the dosage, and it's very important to understand the vehicle or how the probiotics are taken to where they are needed, as well as the quality of the probiotic. Now, what are they essential for? Pretty much everything related with the gut. Digestion, obviously, its digestion is connected, the gut is connected to the immune system. It helps with detox. Why is this? Because if you have an optimal gastrointestinal function, it's going to be a lot easier for kids to eliminate heavy metals, for example. And it helps with behavior. I'm highlighting this one with exclamation marks because number one thing that happens when the gastrointestinal tract or the inflammation in the gastrointestinal tract goes down, the number one thing that you can notice is behavior changes, positive behavioral changes. Now, how do you know that that your kid is deficient in probiotics? Pretty much the very basics: bloating, gassy, burpy, gastrointestinal infections, leaky gut. You can notice about the leaky gut because your kid is either losing muscle mass or is having difficulties to gain some weight, yeast proliferation or yeast overgrowth, okay? Something that is going to be very, very important. Every MAPS doctor, almost every biomedical doctor says that probiotics have to be taken for life. For me, that is almost true, okay? I'm saying almost because when you're an adult, you have to switch your diet for something that suits you the best. However, it's true. For kids, it's something that has to be consumed on a daily basis. Doesn't matter if your kid is on the high side of the spectrum. Doesn't matter if your kid is considered out of the spectrum. Your kid has to consume probiotics because it helps to sustain and maintain the balance that we are looking for in the gastrointestinal tract. Another alternative of probiotics is consuming fermented probiotics, as well as in combination with fermented food, for example. An example of this is sauerkraut, right? Sauerkraut or kimchi is very famous right now. This type of foods create some probiotics, and this type of reaction maintains some form of homeostasis, some form of balance in the gastrointestinal tract. Now, almost to finish, I want to mention 3 common scenarios in which diet can be very helpful. Now, scenario number 1, if there is a situation in which a kid struggles with anxiety, hyperactivity, and or aggression, or all the 3 combined, what we need to evaluate from a visual perspective or from a historical perspective, with all the slides that I just explained, we can consider about magnesium, we can consider about fatty acids such as omega, we can evaluate the anthropometrics, weight, height, based on age of our patient. We need to understand what your kid is consuming. Remember, the fact that your kid is eating a lot doesn't mean that your kid is eating well, okay? I wrote down about taurine and GABA because those have a positive effect regarding relaxation or calming down a patient. Now, from a dietary assessment point of view, what can you do? Start a gentle transition to a clean diet. I'm saying gentle because something that I learned the hard way is that our patients within the spectrum are insanely smart. You cannot treat them that easy when it comes to changing some of the foods that they like. So a gradual transition to a clean diet can be tricky, but can yield good results. Consider phenols. Remember what we were saying about phenols. They are difficult to absorb, and they can cause gastrointestinal behavioral changes. Now, consider also food sensitivity. Remember what we were mentioning about the gluten-free, casein-free diet. This reaction, this sort of sensitivity can also impact behavior. Also, pay attention to the stools. If you notice lots of constipation is associated with aggressive behaviors, okay? Now, when you take this in consideration, then you can consider about what type of supplements to evaluate, what type of supplements to discuss with your doctor, okay? I don't want you just to go right now to the store and get magnesium and taurine and omegas and start bombing your kid. Remember, it's there is an order, okay? And the order is evaluating what your kid is having, intake and obviously outtake, the clinical part or the clinical perspective in which how your kid is expressing the symptoms, and then you can start considering about supplements. Do not bomb your kid, because then you're just shooting in the dark and you do not know which one is working. Now, scenario number 2, communication delays. I'm not talking about speech. I'm talking about every form of communication, from pointing, from screaming, from yelling, from yes and no, from expressing words, from responding to some commands, to respond to their name, to actual verbalization of commands, or putting sentences together. It can be any form of communication. What should be evaluated? Sync, once again. Why sync? Because of the sensorial aspect, all right? The B12 consumption or the folate consumption, especially because, as I said before, low methylation activity is associated with cognitive issues, all right? And opioid avoidance, remember what I just said a few moments ago? Opioid, I'm not talking about drugs or anything like that. I'm talking about some type of foods like casein, soy, and gluten, for example, that are going to cause or to trigger some form of brain fog reaction, all right? It's like putting a brake to the brain of your kid, okay? Now, it can be one of the things to evaluate from the dietary assessment point of view. As I said a few seconds ago, consider gluten, consider milky products, okay? Evaluate the potential dysbiosis. What can you notice? Stool changes, remember that. Consider the potential use of probiotics, as I said a few moments ago. I have it right here again. Probiotics, very useful for behavior, for detox, for immune system, because it helps with everything associated with the gastrointestinal function, okay? It's very important to consider all those 3 things. Then I have in here, in blue, ancillary therapies. What are ancillary therapies? The speech therapy, sensorial therapy, speech therapy, sensorial therapy, maybe occupational therapy. Why is this important? To achieve communication, kids need to address sensorial aspect, or the sensorial part, like responding correctly to touch, to movement, to textures, to something that it's known as stereognosis. That is the way in which that pretty much means putting together all your senses into one thing and making use of them in the correct way without feeling overloaded or overwhelmed. Now, that's very important, because otherwise communication cannot happen out of nowhere. Okay, you need to train it, you need to teach it, and you need to practice it. And then you can consider supplements based on how your kid is responding with the tiny changes that you are considering right here in the list, okay? Finally, scenario number 3, potential sleeping issues. What can you evaluate? Fatty acids, because central nervous system protection. Magnesium, again, behavior. Melatonin, it's a supplement that can help with the sleeping cycle, okay? Melatonin should be taken at night, all right? Evaluate the daily diet. Why is this? Remember, if they consume different type of sugars or carbohydrates after a certain period of time, let's say after 5 or 6 p.m., it's very likely that your kid is going to have problems or sleeping problems, or an irregular sleeping pattern, okay? Also, consider about physical activity. Pretty much, there are some kids that need to practice some physical action, like jumping, running, swinging, doing something outside, a couple of hours, maybe an hour and a half before going to bed, okay? And finally, consider sensorial aspects. There are kids that cannot fall asleep if you do not rock them, if you do not swing them, if you do not hug them, if there is no pressure on top of them. So consider the sensorial aspect. That helps a lot with sleeping, okay? Now, from the dietary assessment perspective, once again, evaluate a clean, healthy diet. A toxic diet can trigger gastrointestinal function, even if it's out of time. It can cause acid reflux while sleeping, and that is going to wake up the kid having the terrible or one of the worst nights, okay? Now, consider phenol reduction, okay? You can use chamomile. Chamomile is a natural anti-inflammatory, as well as it's a natural aid for sleeping, all right? Vitamin B, it's vitamin B, not vitamin D. Vitamin B or B12 or methyl B12 shots, they are very useful. The vitamin B is very useful for behavior, but the main recommendation is never, ever give it before bed, okay? You have to give it during the daytime. Now, as I said before, taurine helps for relaxation. That can be useful to achieve some sleep. However, the taurine is out of tonight's equation because that's a little bit tricky to administer. Now, in blue, what can you consider? Occupational therapy, sensorial diet. Sensorial diet is different exercises in order for your boy to start working with any form of sensorial input, okay? That's very, very important. And finally, then you can consider about supplements, the supplements that we're just mentioning right here. Now, I hope that these scenarios can ring a bell for you. I hope that these scenarios can point you in the right direction, because the main idea is not for you to take this and try to apply it at home. You can start ruling out some things. That way you can approach to your doctor and say, I've done this, I've done that. Can you guide me in a new direction? Can you help me put a new plan together? That's what I'm trying to do here, just facilitating some tools in order for you, especially if you family, mom, dad that are watching this, if you are new to this, okay? Almost to sum up, or actually to sum up, we have to understand where we are, where are we standing, how is my kid doing, and what I want, what we want, what is my expectation, what is what I want to achieve with the diet, what is what I want to achieve with the supplements, what is what I want. But in order to know that, we have to figure out where are we, how toxic is the environment where we are working, how complicated is to control, how difficult it is to achieve this balance, or how easy it is, right? The fact that it's difficult or easy to achieve this balance, the perfect environment for your your kid to bloom, to become as healthy as possible, it's the cornerstone to understand the best approach for your boy, okay? Because everybody wants very, very nice and noble expectations. Everybody wants the best for your kid. However, we need to understand that every journey is different. And there are kids who are a little bit more at it from a start point. That can make the journey a little bit trickier, okay? But that doesn't mean that it's impossible. It's just a matter to sit down and understand with a calm mind, a cool mind, a cold idea with a little bit less sentiment, because we need to think it through. Otherwise, as I said before, there are families that try a lot of things at the same time, and you do not know which one is working, okay? What we want, remember, the main objective is not pushing or making your kid to ride bike. The main objective is finding this homeostasis. If you find the homeostasis, you are almost there, okay? Because then improvements are going to appear almost by themselves. Finally, now to wrap up, if you have any question, if there is a something that pops in your mind, if you want to discuss about the use of some supplements, if there is a question about some other supplements that are not mentioned here, please take the time, feel free to write a message to either one of these emails. The reason why we invite you to do this is because information as well as education is free. If there is too much information for you, if you're feeling overwhelmed and or you found too much information and you're getting confused, drop me a message, drop Dr. Eduardo a message, or even better, schedule a free medical video call, okay, or a free phone call. It's going to be, as it's saying here, the link to this video call or this conversation is going to be tagged somewhere around this video. It's free. I emphasize the free part because we want to share information with you. We want to help you understand, because if the parents actually understand that there is something that has to be done before reaching other, the journey is going to be easier for all of you, not only for you as parent, but also for your kid. Now, once again, if you have a question, if there is something that we can help you with all the trust in the world, feel free to send us a message. There is no commitment. That's something that I want to emphasize. Lately, the past month and a half, with all the patients that we have received since the borders were open, We have noticed that there is a lot of misinformation about the protocols, different protocols that different clinics are working with, okay? If you are struggling with this information and that is hindering you to make an actual decision, whether if it's a yes or no, send me a message. We can help you with that information, okay? With that said, I hope you have an excellent day, evening, or night. Wish you the best. Hope to see you soon. Hope to talk to you soon, okay? Have a fantastic day. Take care, please.
Hola. ¿Me oye? Ay,